Nader.
Mr. Chair, mental health, and in particular rural mental health, was a challenge before COVID-19, now made all the worse by these events. While many mental health services have shifted online, for those without reliable high-speed internet, the feeling of isolation is made worse. Over the past weekend, I spoke with a local farmer and advocate who had to drive off-site to participate in an online mental health forum to talk about seeking the same therapy that he couldn't access online. When will the government make meaningful improvements to rural internet access so Canadians have access to the services they need?
The Honourable Minister.
During COVID is incredibly difficult for Canadians, and the lack of access to high-speed internet makes it that much more difficult. We have been working since the beginning of our mandate to connect over 1 million households to high-speed internet, but our work is not done, and we are working to expedite our efforts to ensure every Canadian has universal access to this essential service.
Mr. Nader.
Mr. Chair, this Sunday is Father's Day. It's also a time that we recognize men's mental health, a cause that my friend from Edmonton Riverbend has long advocated for nearly a decade. Sadly, over 75% of deaths by suicide involve men, and far too many of these are young men. With the isolation caused by COVID-19, access to normal supports is limited. Gyms and fitness centres are closed, affecting both the physical and mental health of Canadians. Far too often, alcohol and drugs are seen as coping mechanisms. To the government, what actions will they take to support mental health services and, in particular, access to addiction services during this time?
Honourable Minister.
Thank you, Mr. Speaker. And I'm pleased, but certainly affected by the question that I'm hearing. I would like to congratulate the member for raising this very difficult issue. We are, of course, all mindful in this House of the particular difficulties that all Canadians go through, including men and fathers. And I would like to assure this House that we have done very significant things over the last few weeks, including implementing a $350 million community fund, including investment in homelessness, including investment for the mental health abilities of services and of provinces to provide services, including helping provinces and territories pay for the essential frontline workers that are so key in those sorts of circumstances.
Nous allons maintenant continuer avec...
We will now continue.